One of the last things I'd like to ask you about is masks. This has become such a hot button issue alongside how do we keep schools safe, things like that. But masks, do you mandate them? Are they voluntary? Where are they helpful? A lot of different discussions. Now, what I'd like to ask you is just simply why didn't, and this isn't just a Sweden question, this is several Scandinavian countries, neighbors as well, that did more of a lockdown. Why don't we see as many mask mandates and mask provision recommendations there?
I'm not an expert on that question. So the other people who know those things much better than I do. So I'm not going to respond to that. But whether they work or not, or how much they work, I have two concerns. One is if elderly people think that they can safely go out in society to a restaurant or whatever because they wear a mask and because other people wear a mask, I think that's very dangerous because it's not going to protect them. So to protect the elderly, social distancing works, but mask is not a substitute for that. So it concerns to me that if people think that they are safe to do certain things because of masks when they really are not. So that's a concern.
I'd like to just sort of open the floor at this point. There's been so many different debates and discussions during this pandemic, and I just want to ask you if there's anything that for your colleagues, we'll do it in two. What would you like the public to know that what information aren't they getting from public health communication right now that they should be getting? And then I'll just ask the second part.
So I think the key thing is that COVID-19 is a very serious disease for the elderly, for those in their 70s and in their 80s, and it's also high risk in the 60s. For children, it's an enormously mild disease, much less serious than the annual influenza that we get every year. And also for young people in their 20s, 30s, and 40s, this is not a dangerous disease. So I think that is one important message to say. And then to young people who wants to live their life normally, they should not be shamed by doing that because they are not endangering others. They are actually doing the opposite. They're actually helping in the long term to end this pandemic. And they should be thanked for that and appreciated for that. If some of them wants to self-isolate somewhere, that's fine. But those who wants to live their lives normally should be allowed and encouraged to do so and thanked for doing so. So to me, that's sort of the two sides of the same message, I think.
Lastly, I'll just ask, we have a core clinical audience. We have a lot of infectious disease clinicians. We have a lot of pharmacists. We have all sorts of different healthcare workers and specialists, laboratory clinical scientists. And a lot of them have had a very hard 6 months. And they feel like not enough has been done. And I know we've talked to a lot of flaws with the public health or the politics of the response, but I also think some of the calls for something to be done come from people who might not disagree with you as much as it seems on the surface. So I want to ask, what is the next step for this conversation, for this more open and respectful debate about population immunity and its role in controlling COVID-19?
Well, first I want to say that while I'm disappointed at many scientists in terms of the public health aspects of COVID-19, and especially scientists outside of the field of infectious disease epidemiology, I'm immensely impressed by the basic scientists who are working out how to come up with testing for for COVID-19, how to developing vaccines, which we don't know what the outcome is, but they're working very hard, and also all the clinical scientists who are trying to find how to best treat patients. So I think those two scientific groups, I think, are very impressive and doing great, hard work, very devoted. So I think that is important to say that. What's next in the discussion, I think that it's becoming more and more clear that we cannot continue a lockdown forever. And those who thought that COVID-19 was like a hurricane that comes and then you hunker down and then it's gone, that's not how pandemic works. So I think that realization is starting to arrive, and we should stop thinking that this will sort of magically go away and deal with it more realistically and see how we will get it through with the least mortality as possible. So I think that should be sort of the focus of the debate, how to minimize mortality in the long term until this pandemic is over.
Dr. Kulldorff, thank you for your insights. Really appreciate you coming on and the work you've been doing.
It's been a great pleasure talking to you. Thank you very much.